In News for Your Health, the possible link between migraines and your heart. Here's Dr. Max.
Well, Sue, migraines are an excruciatingly painful headaches that can lay up a victim for hours, even days. There are different types of migraines, and doctors now believe that at least one may be triggered by something that actually starts not in the brain, but in the heart.
When I got up, I couldn't see on my right side, and I felt like tingling in my leg, going straight to my arms, and I was forgetting things.
Like millions of other people, Sylvia Morris suffers from migraine headaches, but her symptoms are even more troubling than excruciating head pain because they're similar to the symptoms of a stroke. Even the brain scans of people who suffer these kinds of migraines show unusual bright spots.
Are these small strokes that are occurring because an individual has a small micro blood clot flowing through the heart, getting into the brain, which also could cause migraine pain? Or are these something else?
5, 6.
The common ground between migraines and strokes may turn up in this test that Miriam Santiago is having. The headphones on her temples are actually Doppler ultrasound scanners to detect microscopic bubbles that are being injected into her arm. Confused? Here's what this has to do with migraines. We're all born with a small hole in the inside of our hearts that normally closes shortly thereafter. But in some people, it stays open. That's called a PFO, which allows some blood to short-circuit the lungs and go straight to the body and possibly the brain.
Normally, the bubbles just get filtered out by the lungs, and the lung absorbs the bubbles.
But if those bubbles were microscopic blood clots, which can form around this PFO in the heart, they could lead to a stroke. Or, some doctors believe,
potentially very, very small microclots can get up into the brain and cause an irritation and be one of the sought-after triggers for migraine.
So doctors at Lutheran Medical Center in Brooklyn are studying migraine patients to determine whether this hole in the heart may indeed be the cause of some of these so-called complicated migraines. Now, that heart migraine connection was first noticed when patients who had their heart hole closed because they'd suffered a stroke also stopped having migraines. Until the results are in, though, from this study, doctors would not recommend closing the PFO just to treat migraines. But since that can now be done minimally invasively, that might actually eventually happen. So good.